we look at the protests for the last week in the U.S., how does that impact how you deal with COVID-19, the COVID-19 response?
Yeah, it's a great question. I mean, I think in general, COVID-19 has exposed some systematic injustices that people of color are suffering every day. So 13% of our country is black, but well over 25% of the known COVID-related deaths are in African Americans. And over 75 cities have seen widespread protests and demonstrations and some rioting and some looting. And these events are places where the virus can spread easier. So you see places where yelling and singing and chanting or coughing and sneezing from tear gas or pepper spray, all of those things can further spread virus or cause transmission events. So, and then on top of that, all of these are large gatherings. So we know that while these protests are important, they also are going to be transmission events, and we have to be ready for that.
Lauren, looking at some of the figures, it seems that black Americans are dying of COVID-19 at 3 times the rate of white people. Do we know why?
I think that part of it is due to just some general injustices and systematic biases in our medical system. I think there's a lot more to learn about who gets sick and dies from COVID-19 on a clinical level, but I think we know that COVID-19 is good at exacerbating already underlying systematic challenges and systematic injustices. And so we are seeing a group of Americans who are already negatively affected by the existing healthcare system and the existing inequality in the United States, and COVID-19 is exacerbating that.
If we get a second wave, when will we know that it's hitting us? What kind of time frame are we looking at?
Second waves are really hard to predict, given that our toolkit is still limited, and we still do have some challenges with testing. We are expecting to see a second wave, and I think, as we talked about before, these protests will potentially speed up that timeline for a second wave. There are a lot of cities across the country that are reopening, and I think that those reopenings may be happening before we're actually ready to manage another increase in cases. And so people are going right back to what they did before COVID in a lot of circumstances, and those are the places that we are likely to see second waves quickly. It's still too early to know exactly when we'll see a second wave, but I think there are going to be cities across the country that reopened quickly, went back to quote-unquote normal, and are going to see large jumps in cases. And so we have to keep an eye on the hospital systems and the testing data, and if we start to see those numbers creep up again, we may have to actually re-implement some of the approaches that we've taken previously.